cancer may be in a patient's body and ultimately treat it before it spreads further. NBC senior medical correspondent Dr. John Torres joins us now. Doctor, I mean, it's important to note this is a scan. This isn't a new treatment, it's a new scan, but what's the implication of that?
And Savannah, you're right, but it's a scan that's going to be used in conjunction with treatments, and new treatments are coming down the pipeline, so it's important to understand where the cancer might have spread. Now, with prostate cancer, around 250,000 men develop this every year. Unfortunately, around 34,000 die from it, and it's not uncommon for them to get their prostate removed, thinking everything's okay, and then a few years later, they start getting higher levels of PSA, meaning doctors know it has spread somewhere, but with current imaging techniques, they can't find where it actually spread to. Well, now with this new technique, which basically involves injecting a molecule in there that can tag antigen on the membrane of the prostate cell itself, if that has moved to a different part of the body, say the bone, then they can find it using this scan. If they can find it, then they can more easily target it, they can more easily treat it, and it should be more successful treatment as well, Savannah. This is going to be life-saving.
So, Dr. Torres, our guy, Al Roker, he revealed back in November that he had prostate cancer. Fortunately, they caught it early. But for men who aren't as fortunate, and doctors don't catch it as early, it becomes more aggressive. What is this going to mean for that particular group?
Well, this is going to mean a big advancement in their treatment, because a lot of times what happens is they don't catch it early enough. It breaks through the prostate and spreads to other parts of the body. When it does that, they essentially play a guessing game trying to figure out where it went to, because it can go to bone, it can go to lymph node, it can travel to different parts of the body, and then they have to try and get scans to find out where it is. The problem right now with the scans they use, which are usually MRIs or CAT scans, they have to wait till the cancer gets big enough to where they can see it, or it's caused changes in that area. With this scan, they don't. They can detect those small areas of the prostate cancer spread somewhere else, and then they know how to target it, then they know how to treat it, or at least are getting some treatments here that should help with that, and then we'll have a better idea of how to basically let them survive this.
Sounds like great technology that they're using for prostate cancer, and I was just wondering, can that kind of technology be used for other types of cancers like breast cancer?
And Hoda, we're finding out more and more about cancers and specific molecules we can use to detect cancers. And so this should probably give us some idea of how to look at other cancers and specific molecules that might be on that cancer cell itself and how they can detect it. So this is going to be a game changer. It's going to certainly move science forward, but it's certainly for men who have prostate cancer that has spread, this is a big advancement right now.
The potential implications in the technology itself, amazing. Dr. Torres, so amazing. In fact, Dr. Torres is going to come back on the third hour today, 9 o'clock hour. And he's going to introduce us to someone who actually is the recipient of this new technology.
Cool.
So Dr. Torres, we'll see you in a bit.
It's exciting. All right, Dylan, what about the weather?
Well,